Hello, everyone. Welcome to ASB Indonesia and the Philippines podcast. What are we talking about today? Every person has the right to participate fully in the issues that affect their lives. So why are we talking about it? Communication and relationships of trust are essential for every person in every context, in humanitarian, also in development context. So how are we talking about it? Well, my voice is important. Your voice is important. Our voices are important. And of course, we appreciate their voices. So in this podcast, we want to explain why P-FIM is an important approach to put people first and not the agencies and not the programs. And I'm very happy that we have two wonderful persons here. And Agnes, would you like to start introducing yourself? Because before you hand over to Gerry. Thank you, Agnes.
Okay. Thank you, Axel. Hi, everyone. This is Agnes from ASB Indonesia and the Philippines. And I'm working with ASB with community. In my work, I engage a lot with a community for community empowerment and development, specifically in the area of disaster risk reduction, humanitarian response, climate action, and also social inclusion. And in our line of work, we really try to engage to make sure that what we are building in the communities are impactful to their life. So a little story, that's why in every project that we have with community, we will have this what we call feedback mechanism. Why, like Axel said that we want to build the trust with our with communities, and we want them to participate. They have voice. We can listen to them. That's why we have this feedback mechanism. But to be honest, like let's say more than 15 years I'm working in this area, it's not always easy to get the feedback from community. Or there are so many methods we try, but we don't always get the story directly from them. Sometimes we get that not from them directly, like in the project, but through drinking coffee in the afternoon. And I feel like, okay, do we do it correctly? I don't know. And I want to hear it. You talk about the P-FIM, this is an approach, and I want to know whether this is something that we can apply in our work. So this is why I'm here now. Yeah, so back to you, Axel.
Thank you, Agnes. But maybe before you answer, Gerry, could you introduce yourself and then go back to the question by Agnes? Thank you.
Thanks, Axel, and thank you, Agnes. My name is Gerry McCarthy. I've been working in humanitarian development work for many years. Over the last 10 years or so, my focus has been primarily on the voice of people within the humanitarian development response. And together with a colleague of mine, Paul O'Hagan, we developed the People First Impact method, not because we wanted to develop a new method, but because in all of the engagement approaches that we viewed, they all started with the agency at the center, the agency asking the questions and communities responding. We said, what if we remove the agency from it and we just listen to what people are saying? And we listen in a way that allows them to share what's really important in their lives. And what it has now, something that started as a concept, as an idea, is now in more than 40 countries globally and has been mainstreamed by several agencies as part of their way of doing things. And it's very simple. Listening, as Axel, as you said at the beginning, my voice, your voice, their voice, very simple. But why is something so simple not so widespread? And there are several reasons for that, and we can discuss some of that today. So that's who I am, and that's what I've been doing. And it's important to be able to share it in a way that appreciates also the great work that agencies do, but how we can add to it, how we can make it better. And we need to make it better. So that's who I am. So thanks very much for the opportunity to speak with you all today. Thank you.
Thank you for the introduction, Gerry, and also thank you for your introduction, Agnes, and already bringing something up, feedback mechanism. Many people are talking about it. You already raised the question. So people first impact method, P-FIM, how would you respond to the question of Agnes, Gerry?
Yeah, I've seen many examples of feedback mechanisms or complaints mechanisms that are set up by agencies in communities, and the thinking behind it is very good. It's to be able to provide a community with the opportunity to share if there's something that isn't correct, or if there's something that they feel that they would like to share with the agency, or there's a complaint they would wish to make. However, there's an assumption in there, and the assumption is that that's correct, that this notion is correct, that communities will want to share. And there's also the assumption that the agency has the capacity to respond. And what if we were to actually first, instead of responding, instead of setting up the complaints mechanism, what if we were to actually listen first and listen and hear what is going on for communities? I've seen many instances where communities feel frustrated because their traditional way of addressing issues are suppressed, and they feel forced into a mechanism which is alien to them, and not sure whether they trust the system. And so if we were to listen and understand how people deal with their own issues themselves, and realize that, well, actually, there's something working here that's very good. We don't have to fix something that isn't broken. It's already there. And maybe there's a way we can add to it in terms of adding a value. So that listening in that context would change the whole dynamic of complaints or feedback mechanism.
Yeah, so this is very interesting, Gerry. It makes me think about how we listen to community. So at first you said that just listen to them, how they solve their own issues. But maybe this is, I think, generally NGOs doing the same thing. They start with assessment at the beginning, doing some assessment before making the proposal, and then back to their office making the proposal, and thought that we got everything to start with the community, and then we go back to community and we feel like, okay, we are doing the right thing by disseminating this new project, and then listen to them. But then I feel like, okay, this is not really their ideas. Is it correct? I mean, what you say, like you're trying to reconstruct the way we listen to community.
Having traveled to so many countries and contexts, and having been involved with so many agencies and program staff within agencies, local organizations, international organizations, UN agencies, etc., many raise the same question, Agnes. And I have to say, one of my great experiences is meeting so many committed young people in general, certainly younger than myself, who have so much commitment and so much willingness to engage but feel frustrated by the process. They want to do it, but not knowing how to do it. And so listening is not just a question of bringing a group of people together on a Monday morning and saying, off you go and listen to the people. It wouldn't work. We actually spend a couple of days preparing ourselves for this great thing called listening and trust building. And we don't begin with the community, we begin with ourselves. It begins with you, Agnes, and you, Axel, and myself. It begins with us. Because if I appreciate why my voice is important and I am in touch with that, then I can appreciate your voice. So it's not just a question of saying it, it's a question of being in it. And then being patient so that when you're speaking, that I'm not judging what you're saying, but I'm listening with empathy to what you say and how you say it. And that you feel that these guys are really listening, and that my voice matters. What I discovered recently in an exercise I did in Ethiopia, and it was a very difficult exercise because the situation there is quite difficult. One of the participants said, when she was giving the feedback, she said, I realized that the community are ready to share all the time, but we haven't been ready to listen. That's amazing. Ordinary people want to share. They want to be open, they want to be honest. And so it's bringing ourselves to that place where we know how to listen and to appreciate the voice of people. And then we know how to record it, how to bring it together and make sense of it, and then how to take it back to the community. That's what P-FIM is about. That's a great question, Agnes.
Well, yeah, I rethink the way we've been working. At least what I can say from my perspective, with several organization that I work with, I feel like there is something missing there. I can say that. I'm questioning whether we really listen to people. But what you say is very, like, you really want us to go with community and just listen to them. But then how you structurize this approach, because anyway, you have to go back to your office and start planning and then go back again to community and make sure that what you're planning is what people really need, what people really tell you, community really tell you, and you make sure that what you bring to the community, the added value you bring to community is actually their idea and their needs. How do you do that?
Great. I mean, the way that the aid, the way that the humanitarian development aid structure is organized, I understand it and I get it, but it actually mitigates, or it in a way undermines quality of communication. Because what I'm insisting on is gathering data, gathering facts. And then I have all this information. And of course, the questions I use to gather the information are mine. They're my agencies. So they started with me, and then I have all this information. I bring it back and I sit with my computer. I bring the information in and I do analysis and I say, aha, now I know the problems, and now we can now go and we can develop our solutions, and we have this problem and the solution, and we have our program.
So
you're saying that there's a gap in this, and there is a gap.
Yeah.
The gap is that when we've gone to listen, we have listened we have gathered information, but it's not listening. It's asking questions and getting responses to our questions. So if I control the question, I control the answer. And we are also asking people to share their needs or their problems. What are the major needs? What are the major problems? And when you ask me, what are my major needs and major problems, you're leaving out all the rest of me, which is my ability, my knowledge, my tradition, my innovation, my capacity to solve my own issue. All of that is left out because you've confined me into answering at a needs level only. I understand that, but it's very limiting. And so what if in our listening, we were to put aside our own questions and just listen, not listening just for the sake of listening, but listening to actually understand what are the questions we should be discussing themselves, so that those issues come from the community, not us. Then when we gather that information, which is knowledge, it's much more than data and facts. It's called knowledge. It's called real information. We're able to bring it back, present that, and see what are the common issues, common trends that are coming from this community around, maybe it's around access to credit, maybe it's around how can we tell agencies to engage with us better. Maybe it's around corruption, maybe it's around new crop production techniques, maybe it's around all of those things. And we start to see major trends. And then we start to see that issues that are important for the community are important for us as an agency. But the way the community is saying it is much deeper, much broader, much richer than our perspective and our assumption. So we start to inform our assumptions. We start to inform how we understand things. Then we start to realize that what it means to do the right thing based on what the community thinks, not just our perspective. We then have the ability to go back with these issues to the community and say, what do you think? What is the way forward? So instead of us deciding at our desk, this is the issue and this is the solution based on our own perspective, we're able to take it back to the community and agree with them, this is the way forward. I saw an amazing example of this in Congo in response to Ebola. And I saw the awful response to Ebola in West Africa in 2015, 2016, 2014, where agencies assumed it was a medical disease and communities knew it was a social issue. And agencies were bringing messages. But as one group of imams in Sierra Leone said, if we don't trust the messenger, we don't trust the message. And that lack of trust meant that the whole issue went underground, and that's where the deaths happened. And in DRC, the agencies there realized the importance of getting the relationship right, and they applied P-FIM in their approach. And with communities sat down to understand what this is and really listen so that they understood the issue together and they understood the solution together, and that saved lives. It sounds simple. It is simple. And it is important. And it should be widespread.
That's a really a good example. So Gerry, in Indonesia, we work a lot with persons with disabilities, with their organizations, and they are one of the organizations in Indonesia that are not really being seen by many NGOs, let's say, or even other institutions. So we try to encourage them, to listen to them, and try to put them in the center as one of the actors in a humanitarian work, or in a DRR, or in any other work that we are doing. But we are having difficulties in communicating with them. We don't have the keys, or how can I say that, we don't get the tips yet how to approach them really good, because we feel like we open lots of spaces for them so they can say what they really need. But what I feel, to be honest, what I feel like, we are trying to do many things, approach doing many ways to give them space to involve, or to develop their own capacities. But then after years, I feel like it is going slowly. I don't know if we really listen to them. I don't know. This is kind of a little bit some frustration, maybe. But
I understand that frustration, and I think you've articulated it very well. And I think that it's something that it's an issue that is shared by many organizations in many parts of the world. And by the way, it's not a requirement when we do a P-FIM exercise, that we involve people with disabilities. It's not a requirement, but the participants, who are generally from different agencies but local to the area, they always request that we meet with people with disabilities in our exercises, which is really interesting. And other vulnerable groups, and another category they call hidden vulnerable people. And there's something that we've learned in our experience of applying P-FIM, and that is people with disabilities are not isolated, they're not separate from communities, in the same way that people with HIV/AIDS are not separate, that teenage mothers are not separate, that people with people from the from other marginal groups are not separate. They are part of families and they're part of communities. So approaching them as a separate group, to me, it seems in the past, years ago, I think I would have done that naturally. Now I would say, no, this is a community. This is a community issue, and so it's being able to bring the issue and have the discussion with communities in a relationship of trust. And the starting question for us when we do a two-way engagement, real two-way engagement, is the starting question is, this is the issue that you raised about care for people with disabilities is a significant issue for you. What are you doing to address it yourselves? And not just the wider community, but the people with disabilities themselves. What are they doing themselves? And we've learned not to assume that people are doing nothing. They're often doing much more than we realize as agencies. Mm. And they are very much in touch with the physical challenges, but also the emotional challenges. So in that listening space, we hear it. And I go back to something I mentioned earlier, Agnes, and that is the importance of patience in our listening. Mm-hmm. That if people are slow to respond or slow to share, it's very easy for us as agencies to jump in with solutions. Don't jump. Be patient. Mm-hmm. Allow the space. And people share. And then we start to find a place where there's common issue, common ground, common understanding. And then we start to work a way forward. This is how we move forward. And going to part of what I think is at the heart of your question or your observation is that it can be very difficult to actually make contact, to make the connection. Well, I think that's the starting point. I would be able to go to a community and say, this is what we experience. It's difficult. We find it difficult to know how to engage. How can we best engage? What can work? And I remember doing such an exercise in South Sudan. And the teams went out to meet the community groups in a place called Wow. And they went out for the first exercise, which is a goal-free, which is listening to whatever the community want to say. And the communities turned up late. The community groups turned up late. And then in the process of the conversation, when trust was being established, the community said, do you know why we turned up late? And the agency said, no, maybe you were busy. No, we turned up late because you guys never come back. You don't come back. You come, you meet us, but you don't return. And we wanted to give you a bit of your own medicine. We wanted to teach you a lesson. Oh, now that is a huge statement. Let's be honest, right? So that the perception of communities is that agents of the perception of community, the perception communities have of agencies is that agencies don't come back. So they taught them a wee lesson, little slap on the hand there, and so there was a whole learning in there, and the teams asked the community, so how would you like us as agencies to engage with you? And they said, keep your word. Keep your word. You don't need to write a book. You don't need to write 100 pages about that. You just write a few words. Keep your word. Keep your promises. If you say you're going to do it, do it. And so a lot of this is about the art of being able to, how we can go to the community and ask the question and listen. And then keeping our word.
Well, yeah. Gerry, I try to imagine, if I do it, I go to the community and not bringing my own assumption, not bringing my own mission, but just listen to them. But then what happens if what they actually need is not what I can offer or what I as personally and also as organization? How are you gonna do that? I mean, the how our work works, right? Like you have the vision and mission of the organization. You have what the donor agency wants, and then now you go to community, and they have a totally different needs. They have totally different ideas. How you try to balance that with the using this method, the P-FIM?
That's a great question, Agnes. First of all, again, when Paul and I started with P-FIM, we had no idea what was going to emerge. And there's so much learning that we did not anticipate at all. One of the learning issues was the significance of honesty, and also the significance of the maturity of community and the ability of community. We totally underestimate how mature and how capable communities are. I would say, in general, communities are way ahead of agents in their thinking. They play a game with us. They tell us what we want to know. Quite ironic, really, when you think about it. And that's one aspect. And it's important for us to be honest with people. People want us to be honest with them. When we're fluffy and inconclusive and not clear and a bit ambiguous, and we'll say, we'll do our best, we'll see what we can do, that can be interpreted as a promise. And then when you don't act on it, it's a broken promise. Much better to be actually clear, well, that's not something we can do. We can't reach on this. This is not something we can do. People say, fine. I remember one community saying one time the agency came and did a PRA, Participatory Rural Appraisal Program, and they had this long questionnaire. And at the end of the day, they just came and constructed a latrine. And the community said that was fine. But they could have just come and constructed the latrine without all that question. What was all that about? And so communities are far more mature and aware, and honesty is part of trust. So if we want to have a trust relationship, honesty is important. But then there's another aspect to it. There's something that you as an organization, maybe you're not able to address issues around family income, around job creation. That's not in your mandate. You don't have capacity for that. But families are really concentrated and focused on the cost of living because survival is far more important than clean hands. But you have a WASH program, and the WASH issue is way down the list of priorities. However, you know that by addressing WASH issues, you address health issues. And by addressing health issues, you reduce the cost of health care and the family budget. And in your discussion, through your two-way engagement, you're able to present, I appreciate your priority is this, but if we were to address WASH could have this positive impact on your lives, but also your pockets. Okay. Now you have a common understanding of why WASH is important. And then you start to move forward. And so this integration of issues, and goes back to another issue, which is the importance of understanding the context of where people live, so that how you see one intervention is impacting another. And this all becomes very important as part of the reason why listening is important. I'm not sure if that grasps your question correctly, Agnes.
Thank you very much. I was just listening to you, and can I jump in? It was fantastic feeling with you, Agnes, and I'm feeling the same way. But in the global discussions from top-down approaches, there are already ideas how to solve that problem. For example, there's the core humanitarian standards, CHS, there's the theory of change, and then there's the big discussion on localization. So how would you answer to that, Gerry?
Fantastic. The question I ask is, if localization is the solution, what was the problem? And so the issue is, localization has become, it's a sort of byproduct of the World Humanitarian Summit process and the Grand Bargain, etc. It has emerged from all of that discussion. And so there's the assumption, we're back to assumption. There's the assumption that if we're local, we're much closer to the solution or to understanding the issues. And I say, well, yes, most abuse of children happens locally. So, most issues of that are faced by families or whatever are local. So local doesn't mean solution. It means local. That's what it means. It doesn't mean solution. And in my experience, the challenge of engagement, the quality of engagement is across the board. It affects international organizations and local organizations. It affects both. Both are very different. They have very different perspectives on it. large international organizations tend to be bogged down in bureaucracy, and that's a whole other issue and discussion. Local organizations might tend to be influenced by politics or other issues, or have their own vested interests or whatever. And so that's another whole discussion. And so for me, the issue of localization is linked to the role of not local NGOs, local organizations, but globally, the whole issue of civil society, the role of civil society, the role of people to be involved in the issues that affect them. And the challenge is there for international and local organizations to get it right, get the engagement right. And I see this across the board. I see local organizations being just as surprised as international organizations when they listen and truly listen. And I think that's probably a fair description of where the issues are at. Regarding other, we'll say, global trends on standards like the core humanitarian standards, or global approaches like the theories of change, etc. All of these are actually agency-centered in the way they're designed. So they're not designed to bring about change. They're designed to bring about, to improve how we do things, but not necessarily change how we do things. And so that's the limitation. And sometimes, to be honest, the limitation there is that the organizations or the agencies charged with sort of like global overview are themselves unaware of the scale of the challenges of engagement themselves. And they're speaking from the same perspective. They're looking at where the sun is shining rather than where the sun is rising. And so it is important that there is a rethink right in there. By the way, anything I'm saying about my voice, your voice, and listening to people's voices, this is not new. I mean, this has been around forever. And if we look at the psychotherapy as a practice, for example, or the whole issue around care and support mechanisms that are there in many countries, they're all based on these principles. This is not new. What we're doing in P-FIM is bringing these principles mainstream to the humanitarian development sector. That's what we're doing. So it is important that there is a bit of a shake-up, even of the standards.
So Gerry, I think this is my final question for now. So if we see like community is here, and then organization like NGO, local NGOs are here, and on another part is like UN agency maybe, or donor agencies. We should see this on the same level. That's what I feel like talking about people first impact methods, because people are the center, and people are or a community are actually on the same level. So in this case, how do you see NGOs, INGOs, or local NGOs role in this? So they really can listen to communities, and what communities need, what communities need to be facilitated, and like their capacities are also being counted, and they can contribute fully and meaningfully in this process. How do you see our role?
There was some part of your question at the beginning. I think you already had captured the answer, which I thought was wonderful, which is all of these different actors, the challenge is at the same level for all of them. And I think that's very well stated. I think that part of the challenge for us is that we have overcomplicated the whole thing. Life is complicated. I'm complicated. Relationships are complicated. And never mind humanitarian contexts and disaster zones and everything else, just life itself. And we have the ability now as agencies to bring complicated tools to complicated life. Why not make it simple? Why not make it much more simple? Why does monitoring and evaluation have to be so complicated? Why can't we just sit with a community and work out, this is what monitoring is. This is what evaluation is. No jargon, a couple of lines. We agree. This is what we are going to do as a community to monitor. This is what we're going to do to evaluate. This is what we as an agency are going to do. Why does it have to be more complicated than that? I've seen intervention log frames of agencies, of consortia, and you would lose the will to live just looking at it. It is so complicated. And by the time you feed that animal of all of this structure, you're completely absorbed in it, that the engagement part is just so, I can't get there. And so imagine if it was much more simple. And so it's the art of simplicity. And I believe that it is entirely possible to do it. But it does require not just a change in how we listen, but a change in how we do programs. And going back to the origins of these, it doesn't have to be so complicated. And also to lower the word expert. I mean, we're not experts. We're humanitarian people, or we're development people. We have a bit of experience, we have a bit of knowledge, and the more experience and the more knowledge we have, the more we realize what we don't know. And so let's not over-egg this expert thing. And let's allow people who are actually in the situation, let's allow them the space to be the experts, because they're the ones who have to cope. They're the ones who have to cope with the decisions. They're the ones who have to endure it. So let's allow them a bit of space. And so I think that I look at something like the Global Polio Response Initiative, and I look at the way that the different components of technical components, management and communication are brought together on an interagency basis. And I see how that worked. And I say, it's not a bad model. That's a good model. But the communication is at the heart of it. Now, other aspects of the UN don't have, they could learn from that, for sure. But it's there, it's a model that's working. So I think that it's possible for us to join the dots. I think that it really is possible, and to demystify and to simplify.
Thank you, Gerry. This is very insightful.
Yes, thank you very much. I'm listening to you, and it makes a lot of sense to listen. But coming from an international organization myself, I hear people saying, yeah, we are very busy, we have the donor obligations, we don't have the time. So how can we actually do it? If you have some thoughts on that, Gerry?
Yeah, I hear this issue all the time myself, and I've come up with a simple sort of rule of thumb. Spending time saves time. Not just saving time, but it even saves money. I also think that agencies exaggerate how busy they are. I think being busy can also be a hiding place. And but if we think about it in a different way, that instead of thinking about listening as spending time, and then we get on with the work over there, if we can integrate listening in our work, integrate listening in our way of doing things, if it becomes part of the way we do things, then it's not about time wasting at all. And it's actually about maximizing the quality of the engagement and the quality of the relationship, so that what we're doing the right thing, and we're doing it the right way. I mean, how awful it is to see agencies intervening in the wrong way and thinking they're doing the right thing, and then months later counting the costs. And that was the Ebola response in West Africa. That has been, and that's not a one-off, but it was so extreme, it exposed the deficit of communication rather than it was sort of like an accident of a significant event. So we can make it work in simple ways. I was talking to a group of people from Somalia the other day, and I haven't met with them for several months. And I was asking, how is it going? How is the application of the training going, etc. And one wonderful man said, actually, I haven't been able to use it very much in my work, but I apply it all the time now in my personal life. My goodness. I mean, that means that it's already part of the way we do things. And I've seen so many times where I remember a situation in northeast Kenya, and there were two guys, and they were from two different tribes, and when they came in as part of the discussion, they wanted to fight, and the lady who was facilitating, she said, if you want to fight, I can't stop you. But when you finished fighting, I'll still be here wanting to listen to you. So they put their fists away, and one old man said, remember, her name was Evelyn. He said, remember, Evelyn, when you're listening to us, we're listening to each other. So I have seen this multiply, not just within agencies, but within communities, without any push. So I think it's about having a real sense of what works in a communication, and being able to take something like questionnaire, and we have this questionnaire, and we're bringing it to the community for them to give answers. And what about sharing the questions with them and saying, what do you think of these questions? Could we ask these questions in a different way? Are there questions we're missing? And in that little exercise, you brought ownership of the community into the questionnaire. You've taken the mystery out of it. So there are many ways in which we can make it work. And even as part of our teams, as part of our team building and teamwork, what do you think? How do you think we should do this? Rather than this is the solution. So I think that I would want agencies not to hide behind being busy. I would want them to integrate engagement and listening as part of being busy.
Thank you very much. Wow, wonderful. I really want to thank both of you, Agnes, for opening your heart and asking questions that are really meaningful and important for you. I also thank you, Gerry, for finding answers, for going through your experiences and really explaining to us why P-FIM, why listening, why two-way engagement can change the way we are working for the better. So I also want to thank you, viewers, that you took the time to watch this, and great that it's possible to have this ASB Indonesia and the Philippines podcast. But maybe to finish, I would like to ask both of you for one last statement, what the viewer can take away and how we can start changing our work now. So do you want to start, Agnes?
Yeah, sure. So I heard this many years ago, and I tried to apply that in my personal life and also professional life. Do not assume. Don't assume, but ask. But now I have a totally different insight from this talk with Gerry. Don't ask, just listen. and let the question comes up when you are listening. So it will make you ask the right question, not the question that you already have. And it makes me thinking about turn down all the voices in my my mind when I go to community to listen. So I think, yeah, this is the first step I have to do before talking about more like technical things. But this is, I think, the principle of the people first impact method. Thank you very much for sharing this knowledge and insight with us, Gerry. Thank you.
Agnes, that your last comment there is inspiring, to be honest. The shift from asking to listening. I like that. When oftentimes people ask me, you know, and how would they overcome a challenge of engagement or working with teams or working with communities, and they meet maybe more complicated questions and issues. And I say, if you're stuck, think about yourself. Make it personal. Think about my voice. I would like to share my voice. And I would like you to hear me. And I would like to hear you. And sometimes people say, but that's very simple. I said, yes, and it doesn't have to be more complicated. And then when we have ownership at a personal level, we can then work out from there. So I do believe that it is first and foremost about an appreciation of why our voice matters and why we matter. And I think that for me, this experience today has been great in terms of being able to look at some of the experiences of P-FIM over the last 10 years or so. Thank you very much.
Wow. Thank you both Agnes and Gerry, for the inspiration, which is inspirational on a higher level, but also very practical. And I think there are many things which I can start doing from now on. So thank you very much. This is Axel Schmidt and
Agnes Patongloan.
Gerry McCarthy.
Thank you very much for listening to the ASB Indonesia and the Philippines podcast. Stay happy and healthy if you can. Ciao, ciao.